When we talk about our four pillars, you know, and again I'm going to rehearse this all the way, so I'm not just going to talk about work together, get results, but we talk often about compassionate care. And what's really, really important is we understand what underpins compassionate care, and we talk about our four pillars. So we, as far as possible, we put the patient first, we go see, we work together, get results, and we do the must-dos. By far for me, in an organisation that has 6,000 people that work for it or volunteer within it, is the challenge of working together to get results, because ultimately the more complex our patients' needs are, the more that the world is changing. The notion of just trying to do that with just a few people having the best ideas and thoughts about how we can improve, I think is slightly flawed moving into the future. It's very much that we need everybody's thought processes involved in how we make change on behalf of our patients, and also in a way that doesn't make things unnecessarily onerous for our staff. It's really important that we try and get as many people involved in that change, and that's where work together, get results comes in as a way of working. And I've got a couple of things here that I just want people to be aware of, and if you haven't got one of these near you, if I could just say please ask, go to the intranet. This first book here, which is about work together, get results, has just got some really simple thoughts about how we can work together, how we can affect change, and how we can deal with difficult issues. And often when people have been on the work together, get results course, and I was just speaking to some matron colleagues in the community and also some hospital matron colleagues recently, and those that had been on the work together, get results programme all reported about how they thought it was really important that not just they experienced that and started to apply this stuff in practice, but the wider organisation. Because even though these tools are some respects quite straightforward, and some people describe them as motherhood and apple pie, yeah, maybe, but actually putting them into place. So if I say to you the ability to have an authentic conversation, which is one of the things that's talked in here, when you really work that through, it is actually quite challenging to do and do well on a regular basis. So I'd really urge you, if you can, make sure that you at least have seen this book, you've worked through it. If you can get on some of the training and development that's available, please do so. And equally with the book around coaching circles, because that's quite important as well, because all of us, whether it's actually in our working life or whether it's in our personal life, we come to moments where we get stuck. Where the coaching circle stuff's quite good, and it sits within the umbrella of work together, get results, is it just provides a very straightforward technique for dealing with very challenging issues and helping us to perhaps think differently, because we know that one of the things that we need when we're trying to make a breakthrough is particularly to try and think about how we might try and do things slightly differently. So what I would say to you, as far as possible, please familiarise yourselves with these couple of books and the contents within them. If you're unsure or they don't make sense, just please ask. There'll be references on the intranet site, but this is very much where we're trying to get to, because working together, get results is a key part of the four pillars. It's really at the heart, I think, of how we achieve compassionate care on behalf of our patients, and I'd really encourage you to get involved. Thank you.